Greetings and welcome to my channel, Take Control of Your Health. I'm Dr. Corey Stern, and if this is your first time watching, I'd like to extend a warm welcome to you, and please make sure to check out all of the videos on this channel because all of them are designed with one purpose, and that is to help you to not be a victim of the bad guys who are trying to make you sicker, weaker, and stupider. And if you're a returning viewer, I want to welcome you back and thank you so much for all of your support. Your feedback, your comments are wonderful. If you haven't yet hit the subscribe button, please do that right now. And remember to hit like if you like the content because it helps us to reach more people. And most importantly, please share this with anyone you think would benefit from the information. So today I have a wonderful guest that I've been wanting to have on my channel for quite some time. We kind of work together in a way, which I'll explain to you, but we don't really know each other very well. And this is Dr. Anthony Piana, and he is the president of the Professional Academy of Clinical Thermology nonprofit. So thermology is a science that helps to monitor breast health and actually whole body health as well without the use of anything harmful, without radiation. So it can be used instead of or in place of or in addition to mammography. And we'll be talking a lot about that and why it may be advisable for you, whether you're a man or a woman, to have what we call thermography scan. Dr. Piana is a chiropractor like myself. He's been in practice for 30 years, both as he was a chiropractor and a thermographer, and now he is a full-time thermologist. So I'm going to let him talk. Did you want to add anything to that description of yourself?
Nope, you got it. Thank you.
Okay, great. So let's start off by explaining what exactly thermography is, because a lot of people don't know and they've never heard of it.
Yeah, so, they say a picture's worth 1,000 words, and I don't have a picture, so we'll go ahead and give you 1,000 words about it. No, I could probably do it in 100. But so thermography is what it sounds like. I call it thermology, which is the science of temperature. And it could be the temperatures of the environment, mountains, weather. You're familiar with it in many formats, okay? And when it comes down to using it and applying it to the human body, we call it medical thermology, hence the name, the Professional Academy of Clinical Thermology. So what we're in effect doing is monitoring temperatures on your body. We're familiar with the oral thermometer, okay? That was back in the 1800s, coming up with 37 degrees Celsius as the global temperature, the internal core temperature of the body, what it should be. And we're a little bit familiar now in times of COVID with temperatures, temperature measurement going into a restaurant, going in somewhere, a business. And that's part of what I've been doing lately, actually setting those up at airports, Procter & Gamble, Amazon, different places like that for fever detection. But we're familiar with temperature of the body. We just don't know how to apply it on a more microscopic level. And that's what we do as thermologists, is we look at every little pixel of your body, and in most cases about 307,000 pixels we're looking at, which are just the little dots on the screen. So we can measure the smallest areas of the liver, the breast, the belly, the thyroid, the forehead for cerebral vascular, and we can interpret that into a medical interpretation and do two things. Number one, find anything that's an acute disease that we can look for, and I'll explain that in a second. And two, we could use it as a baseline for your health to see if things are getting better or worse, and hopefully they're getting better. As you said, Corey, you and I have worked together, and in that way, what we do is we take a look at whether it's the breast, the thyroid, the face, inflammation in the body, and we chart it, and then we give them some kind of treatment plan, whether it's a health product or some kind of manual therapy or whatever it might be. And then we, 6 months later, 3 months later, a year later, take a look at those images and we see their improvement that they made, okay? I think a lot of what we've done in the past as thermologists, and that precludes me, to back into the 1950s and 60s when this first started, a lot of it was for breast cancer detection. That was big back in the, the early days, and still is today with our equipment. It's even better than what they had back then, of course. We're able to be more precise than they were, but back then this was a regularly accepted procedure until mammograms came out, and the mammogram police came about, and the FDA, who knows what their interest is in that? I have no idea, but they seem to protect it very well. Came in and said, no, 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 everybody else out. It's only mammograms. And literally, I've had my dealings with them over this, but we try to walk a thin line with it to tell people, like you said earlier, it's not in place of. No, it's listed by the FDA since 1982 as an adjunctive therapy or testing. So we call it that. It's adjunctive to, it could be adjunctive to sonogram, ultrasound, but I guess they mean mammography. So they're really protective about that. So we have to be careful how we present this. But I will say that there are people that make their own choices in their healthcare, and I'm for people making their own choices, being their own health advocates. Okay, because in today's world, I think part of your show theme is just that. We know that they're not out for our best interest. They're out there to sell as many drugs as they can, or support whatever special interest groups there are. And we've seen that, without getting political, we see that all over the place, right? So the point is that we have to make sure that we're our own health advocates and we look out for ourselves. And I can't think of a better way to do it than thermographic imaging of the human body. That, along with blood tests, I believe, are actually very effective. So if you have those two things, and then whatever else you choose, that's up to you. Okay, I'm not the mammogram police. I don't try to, defend that. It's just when they start coming after your state license, that's when it becomes a problem, and we have to be a little careful of what we say on this show or any show. But as you know, the thermography that I'm talking about is very easy to use, very easy to access. Lately, we've got about 150 locations around the country now, several in the New York area by you, Connecticut, all over the place, in New Jersey.
What we'll do is we'll put a link
Mhm.
so that people, if they're interested in finding the closest location, they can just hit the link on the video description.
Yep, that's fine. Right below the screen, right? So I'm here mostly on the behalf of the nonprofit Professional Academy of Clinical Thermology. I will say my other hat is my business, Breast Thermography International, and you can that's where the link is to the locations. So anyway, yeah, it's very exciting, Corey. Especially the work we've done together, seeing the results people are getting, and then some more, unfortunate cases finding breast cancer, but we find it early as long as people are going for testing. So those are some really awesome things that we've done with the technology.
Yeah, so with thermography, basically, from my own personal experience with it, both as a practitioner and as a receiver of thermography, you're using an infrared camera, right?
Mm-hmm. Yes.
And taking a picture of whatever it is that you want to look at the temperature of. So it could be breast only, it could be the whole body. And when we talk about breast only, men get breast cancer as well. So we do encourage our male patients to have this exam as well. And so the thermographer just takes a picture with an infrared camera, and there's no body contact, there's no compression, there's no pain, and most importantly, there's no exposure to radiation.
Correct.
Yeah. So once the image is developed, then it goes to you, and you read it, and then you actually write a report about the findings. And the findings are based on the temperature differences in the different parts of the tissue, right?
Yeah, so we have a team of interpreters to clear it up a little bit. We have 3 levels of interpretation that we use. We have our introductory thermologist, who's basically an intern. We have level 2, which is a board certified thermologist. And then we have a level 3, which is our MD, PhD that approves everything that we put through. And like you said, we do breast, we do full body. we call it Breast Thermography International, but that was 15 years ago we came up with this. I wish we called it Total Body International or something, because most of our patients do full body testing, and it's amazing what we find from a full body perspective. And like you said, men and women alike. Okay, we do have more women that do it, but we encourage men to do it as well, because men hopefully care about their health as much as women do. We'll see.
Yeah.
It could be debatable.
Mm-hmm. Yeah. I mean, men, once they hit a certain point, and no offense to any men listening, because a lot of men that listen to this channel are really concerned with their health, but just in general, men tend to have more of a, oh, it'll be okay, I don't have to worry about it right now until something goes wrong attitude. So generally that happens in midlife, where something goes wrong and then they start paying attention. But of course, there's plenty of men that are very concerned about their health, and we do have some male patients that want the thermography. So once we receive the report from you guys, basically what we're looking at is when there's a temperature difference that might indicate some kind of clinical problem. And tell me a little bit more about that. What is it that it's indicating when you see, let's say, a temperature increase?
Sure. Well, the body we know is supposed to be symmetrical, or at least close to it from left to right. So physiologically, we're looking at temperature differences from left to right. It's very similar if you have any experience with acupuncturists. They'll look for hot and cold in the body and try to balance it more on a traditional acupuncture level. So it's similar to that in a way. And I love the combination of acupuncture and thermography, by the way, just as a side note, for that purpose. So we're looking for asymmetries, number one, and it might have nothing at all to do with cancer. In fact, it probably has nothing to do with cancer most of the time, but it has something to do with imbalances, whether those imbalances are coming from nerve conditions from the spine that are being compressed, a peripheral nerve problem, maybe like diabetic neuropathy. Those would cause more cold problems, like say the hand being colder on one side than the other. And then, of course, there's the heat problems, and that's more the inflammatory issues that we see. Some autoimmune diseases, Hashimoto's disease, gout, those are things that will produce abnormal heat. And the big one with women, and we're not FDA cleared for this, okay, so I have to be careful again, but I will say that by looking at blotchiness on the body, many thermologists have correlated that with hormonal expression or hormonal disruption, which we're just pioneering that, really. It's so cool to see it, and then to see the changes we're getting with products like you work with, okay? And there's other products it works with too, but I haven't seen it as consistent, to be honest, and probably because I get more of your stuff than I get anybody else's. But having seen those pre and post images just makes me recommend it to everybody. So that's what I do when I do my individual patient consultations. When they have that type of hormonal imbalance or hormone disruption, that's one. And then the other is lymphatic congestion. There's no other test that we know of that can see lymphatic congestion. An ultrasound can't see it. It might see a swollen lymph node, but it's not going to see lymphatic congestion coming from the sinuses or the mouth, a tooth infection coming down into the neck and just staying there and reabsorbing all this toxicity back into the body. So we're definitely pioneering on a few levels here. So some of what we get is, marveling even to us when we get certain cases back up from the liver, back up from even other diseases that we're seeing. So really awesome. That's what we're looking at. And then, of course, you asked the question. So we're also looking for imbalances in the breast. And if there's a specific area that's hotter, say right in one part of the breast compared to the opposite side, well, it could be a fibrocyst. Okay, fibrocysts are hot, but they're not usually as hot as breast cancer typically, although there are exceptions to that. Traditionally with thermography, that we thought that a tumor keeps getting hotter and hotter. So as we form a baseline, we're seeing that grow in temperature over time. But over the past 15 years, we've charted, the increase in temperatures, and sometimes they plateau out at a specific temperature for that tumor. So it doesn't always grow, but sometimes the body contains it. So there's different variables we have to look at. And we do work a lot with ultrasound as well, because there's two different types of tests. There's anatomical tests, which you're familiar with, MRI, mammograms, X-ray, ultrasound. Those are anatomical. We're looking at like for a bump or something physical. And then there's physiological tests, which are a little bit more harder to understand, such as thermography, which is a physiological test. We're looking for a function of heat. So we're not seeing a tumor or a cyst, but we're seeing what it's causing, what it's creating, the effect, not the cause necessarily. Kind of like I usually use the example of electricity in a wire. You can see the wire on an ultrasound or an X-ray, but you're not going to see the electricity or the heat that it generates. Okay, so that's something that we have to use this type of testing for. I hope that explains it.
And from what I understand, it's, you can possibly see the formation of a tumor earlier for this reason using thermography. With mammography, I think the tumor has to be more established. With thermography, sometimes you're seeing it much earlier before it's detectable, right?
I like how you phrase that, Corey. Sometimes, yes, and maybe even most of the time, but we have no study to compare it. And I hate going back to the FDA all the time, but when they interviewed me for 5 months on the phone and tore apart my website, that was one of the things they said is like, well, maybe it is earlier, but where's the study to show that? And we don't have it. Okay, we don't have that study, but if we use common sense, like you're saying, a tumor, in order to show up on an X-ray, and a mammogram is just a glorified X-ray or more specific X-ray. So to show up on X-ray, it has to have a certain density, whatever that number is, to show up through the tissue, through dense breasts, to show itself. And of course, as we know, that's already a problem, women with dense breasts. So we can't really always see it either on a mammogram. So earlier, yeah, of course, because they're not seeing it at all sometimes, right? But and I think they claim to be 82% effective, okay? But having said that, while that tumor is developing, common sense would tell us that it's creating inflammation in the tissue around it or acquiring a blood flow. So either the inflammation from the growth of the tumor or the increase in blood flow from angioneogenesis, we're able to see heat there and draw our attention earlier. And there's been many, many times I've sent people for ultrasounds of that area that we see the heat and it comes back negative and they're like, oh, this thermography stuff shows false positives. It's not good. And hopefully they're smart enough to show up again a year later or 6 months later when it does actually show up on an ultrasound. And we've had too many of those happen, unfortunately. People don't understand because we are indeed many times seeing things earlier in those cases from a clinical perspective, not a study perspective, to clarify the difference. We're seeing it earlier. So that means that if you go get it double checked by mammogram or ultrasound or MRI for that matter, you might not actually see it yet. Yet's the key word. And it doesn't mean every hotspot's future cancer either. I want to put women that are worrying about that sort of thing, clear up their conscience a little as well. But if you follow the study that was performed, and I don't know why, again, the FDA doesn't go after mammograms, because the study from the New England Journal of Medicine in November of 2012, done by Dr. Gilbert Welsh from the Dartmouth Institute, he showed that 1/3 of all cancers were overdiagnosed and therefore overtreated. And most of those were because of ductal carcinoma in situ. The body has a way to sequester, and many times, cancer and encapsulate it in the scar tissue. So it's not active. Like, it won't show up on thermography, by the way. Those people will not show up on thermography because they're just not hot. They're encapsulated. They have cancer cells, but they're closed off. And it's not until you go in with a biopsy after a mammogram and pull them apart that they become a problem. Okay, so the studies have been done, women in their 90s that died from something else have had plenty of breast cancer in their breasts. Okay, so that's not every type of breast cancer is going to kill you. It might mentally kill you knowing it's there because you went for the mammogram, but it's not going to, in many cases, 1/3 of those cases, it's not going to do anything, any harm to the body. So that was a problem. That was 1.3 million cases out of, I can't remember the number of cases, but it's in the article, which was a lot, okay, of overdiagnostics going on. The other thing that they don't even really talk too much about anymore is the dense breast thing. If you remember 10 years ago, 8 years ago, they were going to change the age from 40 to 50 years old to get tested. Okay, Canada did, other countries did, some countries did away with mammography. But if you look at that, it's because women with dense breasts. I just had a patient this morning that I did a report on. She was born in 1944 and has dense breasts, and they can't do the mammogram on her. So it's not just an age thing; it's a density thing. And I think under 40, though, I think the majority of women have dense breasts, and even till 50, until after menopause, when they start to the density decreases, and then they're able to maybe do a mammogram. So I joke with people, not that it's not nice to test grandmothers, but all we're doing is testing grandmothers with mammograms, not the women that have young children that will die of breast cancer and leave kids behind. That's where I believe we're a perfect fit for that. Thermography is a perfect fit for those women. 20 years old. I had, she was born in 2001. I just had a breast cancer case. So she's only not even 20 this year. And that's sad, and she found a lump. It's not because she came in early and got tested. She found a lump. So now she has full-fledged breast cancer into her lymph system, which the prognosis goes down a lot when that happens. Okay. So now I would rather her come in when she's 16 or post-puberty, come in every year or two, get checked, and find that before it becomes a big problem, especially women in their 20s and 30s and 40s. Well, I've had so many women say, I don't have to get tested because I'm not 40 yet. Well, about 20% of breast cancers happen to women under 40. So that's something to think about.
Yeah, that's a great point. And it really doesn't hurt to get a baseline as young as possible. And then if that's clear, then you just, come back every so often and make sure and monitor it, because I don't know the statistics off the top of my head, but clinically we're seeing more and more cancers walking in the door and at younger ages. I just had a referral of a 23-year-old with third stage. They don't know what kind of cancer yet. So this is something we're seeing, and everything I talk about on my channel is chemicals that contribute to the high rates of cancer that we're seeing. But specifically with breast cancer, it's worse because of underwire bras, which actually create more of a problem. That's the only part of your body that you're compressing all the time.
Yeah, I'll even add to that, Corey. I know there's a lot of talk about underwire bras, and I agree with that. That's true. But looking at thermography, and if you go on our website, I think we still have a picture on there. It's not just the underwire, it's the strap over the shoulder and the strap around the back. And you can see the ischemia that it creates. And I'm talking about women that have had their bra off for 15 minutes before we test them, and you can always see the ischemia. But that means that when you go for a blood test, they put that elastic band around your arm. Okay. Well, that shuts down the blood flow, the venous return, to distend your blood vessels. Well, a bra is about as tight as that on most women, the way they wear them, especially. Okay, so it's blocking venous return, it's blocking lymphatic flow. And if you notice, that's where most women, well, I've noticed, get skin cancer is above the bra line. Okay, so I wonder, and again, there's no study, I don't have a study, just my observations over the years of seeing melanomas that happen right above the bra strap. And I happen to wonder if it's because you're not getting the lymphatic crossover from above and below, washing that area out of its immune system. Okay.
Yeah, no, that's a good point. And I wish there was an easy solution. I think there are some. Do you have recommendations for specific brands that are a little bit less compressive?
I don't have brands. I know fittings. Women try, especially women with bigger breasts, have a harder problem trying to, get, so they have to go tighter to get them to lift up.
Yeah.
I actually did a video for a group called something Campaign for a Braless America or something like that. They wanted some thermal images from me, so we did them. I think that's the easiest solution, if you can, is to go as braless as often as you can. I understand there's restrictions to that sociologically, but that would be the best solution. And of course, lighter fitting bras, some women say I wear sports bras so I don't have the underwire, but that's not the solution because it's tighter around the torso.
Right.
So you got to really, I try to come up with many ideas, and one of them are those little things that lift the breast up a little bit without a bra. The plastic that you glue, but then you got adhesives and things to worry about and plastics on your body. So
Right. Right. Right.
I don't know if there's a good answer for that, but try to be creative the best you can.
And make sure the minute that you're, in your house, take it off. I know people that just keep it on. I even know I've had patients that tell me they sleep with their bra on, and
Huh?
that's not a good idea. So
Very common. Very common.
Yeah.
To add to that, one more thing, Corey, is I said 15 minutes of acclimation time. There are women that have taken their bra off for a week or two, and then I do a thermal test on them, and you can still see those marks. In fact, sometimes it's dug into the bone. The bone actually resorbs from that. Okay.
I've seen that. I've seen women who have actual dents here from the strap, and I don't understand how it doesn't bother them. But if you think about it, most women start wearing a bra when they're a teenager. And so you're talking for some people 50, 60, 70 years of wearing and, getting used to it, not even noticing that it's there. Personally, I feel uncomfortable, always feel uncomfortable with them. I really wish we can invent a way to be able to take your breasts off and leave them home. You don't need them.
Yeah. Well, Angelina Jolie, I guess, did something like that, but I don't recommend that approach. So.
Right. Yeah. No, that's just a fantasy I've always had. So just to talk about some of the other major causes of breast cancer, definitely, you were mentioning the hormonal disruption earlier, and that shows up on the thermal images, we think, as it looks like leopard kind of spotting. And that's one of the things that I've been successful with as a practitioner is detoxifying bodies and cleaning up that stuff. And then the next image looks better. So detoxing and what we call drainage. So you were mentioning earlier, liver backs up, other organs that are supposed to drain. So the liver, the bowels, the spleen, the kidneys, they're all responsible for detoxing. And if any of those organs are not draining properly, you can have a backup of toxins and hormones in the tissue. And toxins are very often hormone disruptors. I've spoken on this channel extensively about things like commercial seed oils. Actually, commercial cooking oil is a hormone disruptor. It's made with hexane gas, and a lot of the chemicals that are in foods and glyphosate, which is a weed killer, is in so much of our food. All of those are hormone disruptors, and that can also lead to not just breast cancer, but cancer, any kind of cancer. But what other? Can you think of anything else? Any other risk factors? I know there's a genetic risk factor. Yeah. Anything else that jumps off the top of your head?
I think a big one, and I do explore this, every woman that gets breast cancer, which unfortunately is a lot in our system, I'll try to interview a little bit and find out, what's going on. Of course, genetics isn't as much as we think it is sometimes. My off-the-cuff number of percentage of breast cancer cases that had genetic correlation was about 20% of the cases. So it's not huge, but it's not small either. So it's not something to ignore. If you have a history, get tested more frequently, of course, in the family. But I think you mentioned a lot of them, just the hormone disruptors, the pesticides, the plastics, anything that's toxic, dry cleaning, household cleaning. Now, I don't know for sure. I can't draw a direct correlation to that, but it's common sense. And what we've seen with the leopard spots you're talking about, I can correlate it to that. Okay, for sure. And when they eliminate that stuff and they go on some of these things that you have put patients on, I see the direct result with that. So that is true. The one I might add to that is adrenal support and stress in general. I think, especially today with everybody, I just had a woman that she couldn't, she blamed everything on the elections or whatever. I'm like, okay, look, just turn the news off, get stress out of your life as best you can, start meditating more, and just, go for a walk or something in nature, do something. I know it's a beautiful autumn day in New York City. I can see that's great. However, yes, those are the things to do, is surround yourself by more positive things and get rid of the negativity and the stress. I think that is another huge thing that people need to pay attention to.
So true. Yeah, I actually have a whole video on that topic, and stress actually causes nutritional deficiencies, and specifically minerals. And there are actually a lot of studies that show how your emotions affect your health. And easier said than done for many people. You actually have to learn how to manage your stress. And it's one of the things that I teach patients, because some of them don't ever get well if you don't address that issue. If they're constantly, the effect of their environment constantly unraveling because of stuff that's going on around them, whether it's going on in the world, or whether it's in their family, or at their job, or stress is a normal part of life. It never goes away. It just changes form and it changes intensity. But the sooner that you come up with a viable way of handling it, the healthier you can be. So, and the other thing I wanted just to mention is what are your thoughts about breast health and iodine?
So I know there's a lot of people in our system working with that, and I can't honestly tell you that I see a direct correlation with it. I know it makes sense from a physiological perspective. I just have no actual, again, I'm big on studies. If I don't see it, I don't say it, hopefully. But that's what I am. If I see something that happens clinically over time, that's something that you and I maybe could pay more attention to, and maybe do a small little pilot study on something like that. That would be helpful, because I do believe that there is a good possibility that it's very helpful. And I know many practitioners say that it is, and what guidelines or basis they're going by is, up to them. And it's not something that I've worked with extensively, is what I'm trying to say.
My viewpoint is that if you're deficient in any nutrients, your risk of developing disease increases. And iodine is a big one, simply because so many people are deficient in it. And I think so much of your body tissue requires iodine. And what most people know, not everybody knows this, but what most people know about iodine is it's required for your thyroid to create thyroid hormone. And that's how most people think of it. But the truth is that iodine is required by many, many organs and tissues in your body. And I think, if I'm not mistaken, every cell in your body has iodine receptors on it. So the problem with iodine is simply that it is not very available in the food supply. Most people get their iodine through iodized salt, table salt, and that's not really a good source. That's synthetic, man-made. You need it from the earth. Pink salt, Himalayan salt, sea salt has some iodine in it. Kelp and seaweed have iodine in them. And so we use iodine supplements that are made from iodine and kelp. And then we also recommend people eat salt, good quality salt. And I do see improvements, and not just in thyroid health, not just in breast health, but even I had a patient with unresolving reflux. And when we started to add a little bit of pink salt to her water, it went away. Voila, because your stomach acid also needs salt. So it's one of the things that people are told: salt is bad for you, don't eat salt. But that's not exactly correct. It's bad salt is bad for you. Good salt is a necessary nutrient, and your nervous system requires salt to function. So every cell needs salt. You have sodium channels in every cell.
Yep,
So Yeah, so it's not only iodine, but like you said, I know a lot of people in the thermography field are iodine pushers. I have a technique called muscle testing that I do where I can actually ask the body's innate intelligence, do you need this? And we find that, we get best results doing that because we're not guessing. We're not having to guess what the body needs. We're just using the body's intelligence and communicating with it directly, which sounds a little wacky if you've never heard of it before, but you know what my evidence is? My evidence is my results. So yeah, I don't need a study.
Very good.
Uh-huh. So was there anything else that we missed or that you wanted to add? We'll definitely put links to your organization is called BTI, right? Breast Thermography Inc. Is that what
International.
it's
International.
international?
Thermography International, and the website is btiscan.com. You can put that at the bottom if you want.
btiscan.com. Yes, I've actually sent many people to that.
And there's a lot of locations around that you can choose from.
Mm-hmm.
No matter where you are, I assume this gets to more places than just your area. This video.
It actually, I have people watching from many different countries. So is there information on there or is it just USA?
I can help them. We don't have a lot of different countries. We have several different countries, but if they need somebody in a certain country, I have access to other thermologists.
Okay, excellent, wonderful. All right, so if was there anything else you wanted to add or should we end here?
No, we could do something again in the future if we need to, but I think for today, that's a lot of information for the listeners and viewers, and hopefully it helps. And if there's any questions that I could personally answer for anybody, my email is somewhere on that website. You can find it and send me an email, ask me a question, okay?
That is great. That is so helpful. Yes, so do that rather than putting your questions on the video, because then I'll just be emailing him your questions. You can get them directly. Thank you so much for that, Dr. Piana, and thank you for taking the time out today to give us this really critically important information. So I will end here. Please don't forget to subscribe, like, and share with anybody you think needs this information. And I would say pretty much everybody needs to hear this information. So I appreciate you viewers, and we will see you all again very soon.